If you suddenly started experiencing physical symptoms or had an accident and thought to go to the emergency room, you have experienced a classic acute condition. Now, acute illnesses include common viral and bacterial diseases such as pink eye, strep throat, and sexually transmitted infections. Physical symptoms such as headaches, seizures, or constipation can also be considered acute. These can become chronic, or symptomatic of chronic conditions, though. To be considered an acute case, the patient will experience rapid onset, and the condition lasts for a short time. Note that even though a condition can be short-acting, it can still finally result in the patient's death. The defining factor of an acute injury is the suddenness of it. Personal injuries from falls, car accidents, violent trauma, or household accidents are all examples of acute injuries. Sometimes an acute injury can occur because of a chronic condition. For example, a woman who trips and falls may get a broken bone because of her pre-existing osteoporosis. With her weakened bones, she is more susceptible to an acute fracture than a patient who doesn't have osteoporosis. So how do nurses help patients manage illness? A nurse wears many hats in the course of a day's work. The nurse assesses the patient and identifies needs that the patient is unable to meet on his own. Then, the nurse makes a plan to meet the needs and carries out the planned interventions. At that point, the nurse reassesses the patient to see if the plan met the previously identified needs and may identify additional needs that need to be addressed. Let's look at some examples. 1. Heart attack. As soon as a heart attack, blood clot blocking blood flow to the heart muscle occurs, an imaginary clock starts ticking. The list of choices of what can be done to prevent long-term heart damage shrinks as more time passes. If the patient arrives in the emergency department in time, there is the option of rushing the patient to the cardiac catheterization lab where the cardiologist performs a procedure. That removes the clot blocking the blood flow to the heart muscle. Nurses are the ones who meet the patient in the ED, recognize that a heart attack is likely happening. Obtain an immediate electrocardiogram, give an aspirin while running the ECG. And take the ECG to the physician for immediate interpretation. If the ECG shows a certain kind of heart attack, the phone call goes out to the on-call cath lab staff. Within 90 minutes of arrival in the physician, the patient has been rushed to the cath lab, prepped by the nurses. And a cath has been done by the cardiologist, clearing the blocked artery. Nurses play a number of roles in this scenario: clinical assessor, coordinator, diplomat, patient advocate, psychologist, and recorder of events. Once blood is flowing again, the emphasis of care changes to preventing repeat events and strengthening the heart muscle. The roles of the nurse include clinical assessor, ECG interpreter, and teacher. In cardiac rehabilitation programs, nurses monitor the patient's vital signs before, during, and after therapeutic exercise sessions. The nurse also teaches the patient about each of the prescribed medications, how to take care of themselves at home, and what symptoms need to be reported. The nurse teaches signs and symptoms that indicate emergencies, and which signs can wait to report until the next time the heart clinic or doctor's office reopens. Nurses also explain how dietary habits can affect heart health. Now, a stroke, blood clot or bleeding in the brain, can take many forms, from no symptoms to partial disability to immediate death. When a patient survives a stroke, there are educational needs for the patient and/or family caregivers. The primary education every stroke patient needs is how to prevent another stroke. The nurse in this situation assesses and identifies the patient's needs, makes a plan to meet those needs and implements that plan. Depending on the signs and symptoms, the nursing care plan may include therapy from other healthcare disciplines as well as nursing. The nurse is instrumental in coordinating all other disciplines: physical therapy, occupational therapy, speech therapy, dietitian. Arranging for numerous tests, making plans for care, equipment, and supplies needed after discharge from the hospital, home health nursing or home hospice, or skilled nursing facility, or long-term care facility, or hospice facility. Teaching about medications and how to administer them, and teaching the skills needed for caregiving in the home, such as managing a feeding tube, skin care, frequent turning, how to use equipment, and menu planning. The role of the stroke nurse includes educator, cheerleader, care coordinator, instructor, patient advocate, discharge planner, and recorder of events. Moving on to diabetes. When a patient requires hospitalization for diabetes, he is usually very ill and may need intensive nursing care to achieve and maintain stability. The nurse in the intensive care unit (ICU) approaches her patient as do other nurses, by starting with an assessment of needs. In the ICU, these needs may include help to breathe, multiple intravenous medications that require frequent dosage changes based on patient's response, lots of social support for loved ones, and much interaction with physicians and physician office staff to communicate changes in the patient's condition. Once stabilized, the patient can be moved out of the ICU. At that point, the patient's main need is to learn how to manage his blood glucose levels at home. Nurse diabetes educators spend time teaching the patient how to check blood sugar at home, what signs and symptoms may indicate blood sugar levels that are too high, low, and what to do about each. Many patients have concerns about whether or not their children and grandchildren may catch diabetes since it is genetic. The nurse plays a role in identification of risk factors, early identification of disease onset, and patient education on what to do to control diabetes and prevent or delay complications. One area where nurses are particularly effective is when the patient's treatment requires starting insulin therapy to reach the healthiest blood sugar levels. Some patients are very reluctant to start insulin. Usually with education and instruction from a diabetes nurse educator, the patients will be able to overcome their reluctance and successfully use insulin and other medications, along with diet and exercise, to control their diabetes. The role of the diabetes nurse includes educator, cheerleader, instructor, patient advocate, coordinator of supply, equipment acquisition, and, of course, recorder of events.